I'm Emily Fisher. I'm the program director of the University of Oklahoma Emergency Medicine Residency Program. I've worked here for the past 5 years. Moved here from Chicago where I did my medical school and residency training. Our residency program just graduated our 10th graduating class, which we were very excited about. We recently increased from 6 residents per year to 8 residents per year. There's a great need for emergency physicians in the state of Oklahoma, and we've really taken great pride in our ability to fill that need.
So I'm Schuler Polk. I'm from Greenville, South Carolina. I'm one of the 3rd-year chief residents for this upcoming year. So I ended up coming to Tulsa out of the blue, honestly. I got an away rotation here and came out here for the month of July of my 4th year of med school and loved it. Really got to know the people well. Even as I went on the interview trail over the next few months at the name brand East Coast programs that I thought I wanted to end up at, I couldn't get Tulsa out of my mind. The people I'd met there, from the residents to the faculty, and the relationships that I had developed, and I ended up ranking it #1 and wanting to come to Tulsa, Oklahoma to do residency.
So I'm Chance Dotson. I grew up in Oklahoma City and went to medical school here in Tulsa at the OUTU School of Community Medicine. I think I had a pretty unique view of the program training here in Tulsa as a medical student, and I think just seeing how the faculty really did care about the development of each resident.
As a smaller residency program, our residents are really close with our faculty. We're very accessible. My residents all have my cell phone number, text me at all hours of the day and night with different questions or concerns.
The size of our program lends itself to being able to be very dynamic as new needs arise. I think that's something that I've been able to benefit from.
Well, my name is Bo Burns. I'm the chairman for the Department of Emergency Medicine here at the University of Oklahoma School of Community Medicine. I've been here since 2007. I was actually one of the first faculty that was present when the department started. I moved back to Tulsa from Texas to help start the department. We've changed our curriculum in the past based on input from students, from interns, 2nd years, 3rd years, and faculty. It's something that we take very seriously.
So our didactic curriculum has gotten revamped over the last year. We have a curriculum called Foundations in Emergency Medicine that we use that goes through week by week, and we go through case presentations and work through a specific topic every week. And over the course of a year and a half, it goes through a global emergency medicine curriculum.
Our curriculum is very, very ED heavy because we believe that emergency medicine is best learned at the bedside. Our intern level providers are able to care for all levels of patients, no matter how sick. We don't pull the high acuity patients out and save those for our upper level residents. We of course do appropriate supervision, so we make sure that they're not flying blind or alone in this process.
Another thing that I think makes Tulsa really stand apart is that we get to rotate in all of the major hospital systems in Tulsa. They are community emergency departments, and so with that we do work with plenty of specialists and different specialties.
We are unopposed in our department, so we don't have any surgical subspecialty residents at our facility. We have attendings to back up for any procedures that we need assistance with, but any procedures that are appropriately within the scope of emergency medicine practice, our residents get to do primarily. Our residents are getting all of their procedures typically done by the end of their intern year, which is really unique and is something that you're not going to find at most programs.
I think again an advantage of the size of our program is that you get to work pretty consistently with your attendings, and from that they're able to see you and give you personalized feedback that helps you really develop and grow as a resident.
Coming to Tulsa for me would mean a place where the faculty would care about me and challenge me to be the best emergency physician I could be, and it was a small enough program to where you couldn't really just skate by as a number or a statistic.
Really the significant livability of Tulsa. So it's something that until you've seen it, I really don't think our applicants have any idea how great a city Tulsa is. It's really the perfect size. So it's low cost of living because it's a smaller city, but it still has all of the resources and fun things to do that you'd find in bigger cities.
One of the big surprises to me and my wife was how much we've loved Tulsa. It's a good sized city to where it's big enough that you have a lot of big city comforts like good restaurants, good local food, tons of new breweries opening up, cool parks and everything in the city, but it's also really cheap to live and really family friendly.
But what's important to me is that we help you become a transformational leader, that we help you maximize your leadership potential as you go out and you become a member of your community and of your hospital. We're not interested in just training mediocre residents or the status quo. We want people to come here and become the greatest version of themselves that they can be.